that is the last phase of your kinetics, elimination. We have seen the elimination. These are the routes of elimination we have seen already. I will just revise it quickly. What are the different routes of elimination? As there are different routes for administration, drug administration, as like that route of administration, there are certain route of elimination. So most of the drugs, they are eliminated through a urine. Most of drugs, they are eliminated in the urine. Okay. Then mostly acidic, weak acidic and weak basic drug, weakly acidic drug and weakly basic drug, so they are removed in the urine, either in the form of unchanged drug. जो ड्रग लिया आपने उसका कोई मेटाबॉलिज्म नहीं हुआ एंड इट विल बी अनचेंज्ड, रिमूव्ड अनचेंज्ड. और मोस्ट ऑफ द ड्रग्स का मेटाबॉलिज्म होता है. मोस्ट ऑफ द ड्रग्स आर रिमूव्ड in the urine in the form of their metabolites. Okay? But few drugs are eliminated in the urine through the urine which are unchanged. उसका कोई change नहीं हुआ. Okay? Then some drugs are removed in the feces, erythromycin, ampicillin, rifampicin, etc. Some drugs are removed in the exhaled air, like anesthetics and alcohol. In the saliva, lithium carbonate, okay, rifampicin, metronidazole, etc., etc. So these drugs are removed from the saliva or eliminated in the saliva or excreted in the saliva. In the sweat, antipyrine, alcohol, as I told you. In the milk, lipid soluble drugs. Okay. You know that for the absorption, lipid soluble drug is required, and for the elimination, you require water soluble drug. That is the in between that there is an important role of metabolism. So metabolism will convert lipid soluble drug into water soluble drug. So elimination is nothing but the removal of metabolites of drug from the body, mainly by renal excretion, mainly by kidney excretion, mainly by renal excretion. Likewise, that renal excretion, other organs are also responsible for the elimination of drug. So other organs also has a capacity to remove the drug. For example, your lung has a capacity, your biliary system has a capacity, intestine has a leaf, okay, salivary gland, sweat gland. So some drugs are removed in these also. So if drug is being eliminated, if drug is being removed from body via kidney, it is known as a renal excretion of drug. And if drug is removed by other routes, for example, lungs, biliary system, intestine, saliva, sweat gland, so it is known as a non-renal excretion of drug, right? So we have seen this. We have seen what do you mean by GFR, glomerular filtration rate. Okay, that is nothing but the amount of blood or amount of water filtered by glomerulus per unit time. Amount of drug or amount of water which is filtered by glomerulus per unit time. We have already seen that. And remember, GFR is closely related to two things. First is nothing but the inulin clearance, and second one is nothing but the creatinine clearance. Okay, you have to remember this. Okay, so GFR, normal GFR is nothing but the 20 to 30 ml per minute. So amount of water or blood filtered through a glomerulus per unit time, that is nothing but the your GFR. And GFR, the close measure of GFR is nothing but the creatinine clearance and inulin clearance. Clearance. Okay, you have to remember this. Then we have also seen the sum of individual clearance. जितने भी clearance है, मतलब different organs or elimination of drug via different routes of elimination. So sum of the individual removal of drug by different route of elimination, or you can say the summation of individual clearance by all eliminating organ is known as a total body clearance. We have seen this. And what is meant by clearance? Clearance is nothing but the hypothetical volume as that of the distribution volume. Distribution volume भी क्या है? It is also hypothetical volume. That is nothing but the amount of drug which is present in the different body fluid. So that is the distribution. Now clearance is nothing but it is again a hypothetical volume of body fluids from which drug has been removed, or drug has been filtered, or drug has been cleaned, okay, completely in a specified time. That is nothing but the clearance. Okay. So clearance is the hypothetical volume of body fluids from which drug has been cleared per unit time, or in a unit time. That is known as a clearance. It is expressed as a ml per minute, and it is okay. It is expressed as a ml per minute, and the clearance is constant for particular drug at a given plasma drug concentration. Okay, we have seen that. Okay, we have also seen clearance is equal to elimination rate divided by plasma drug concentration. We have seen renal clearance means clearance by kidney. Okay, clearance by kidney. We have also seen this. There are different route So which kind of drug are eliminated by which kind of drug? In the urine, mechanism for elimination क्या है? Glomerular filtration, active secretion and passive or active reabsorption. So कौन से drug eliminate होते हैं? So only free drugs, hydrophilic, unchanged drug molecule or their metabolites or their conjugate having molecular weight okay, less than 500 electron. In the bile, active secretion is there. Drug is actively secreted in the bile. And which kind of drugs? Hydrophilic drug, unchanged drug, okay, sorry यहाँ पे lipo होने चाहिए. So lipophilic drug, unchanged drug, metabolite and their conjugate having molecular weight near about 500 electron, okay. So bile. Then lungs, in the lungs also, lungs में drugs will be excreted by passive diffusion, okay. For example, gaseous anesthetics, okay, gaseous and volatile anesthetics. Then blood and tissue insoluble drugs, okay, alcohol is also there. Is another route is saliva, passive diffusion and active transport is the mechanism for elimination or excretion of drug in the saliva. Only pre-drug unionized lipophilic drugs, okay, or polar drugs, they are excreted or secreted in the saliva. Now in the milk, again, milk, in the milk drugs are passively diffused, okay. Which kind of drugs? Free unionized lipophilic drugs, mainly basic drugs, they are diffused in the milk or they are secreted in the milk. In the sweat also passive diffusion is the mechanism, free unionized lipophilic drugs are secreted. In the intestine also passive diffusion is the uh, is the is the mechanism for elimination or a mechanism for secretion. And water, okay, which kind of drug? Water soluble ionized drug, okay. So here I would like to explain you one thing. Here what is meant by enterohepatic circulation? What is meant by enterohepatic circulation? टर्म क्या है? कल नहीं बोला था मैंने. Enterohepatic circulation. What do you mean by enterohepatic circulation? Enterohepatic circulation. Entero means what? Entero means intestine. So enterohepatic circulation means what? Entero means intestine. Hepatic means liver, and this is nothing but the circulation means flow. Okay. So what is enterohepatic circulation? क्या होता है enterohepatic circulation? For example, one drug is there known as a digitoxin. What is the name? Digitoxin. It is a cardiac glycoside. Cardiac glycoside used in the congestive cardiac failure. Digitoxin. Okay. So this is the drug digitoxin. So what happens if you take this digitoxin tablet? So what happens? This drug is absorbed from the intestine. Intestine में से इसका absorption होगा. It will go into the blood. It will get distributed. It will show a mechanism of action. This drug is actively secreted in the intestine again. ये drug क्या है? Actively secrete होता है intestine में. It is a highly polar drug, so it is actively secreted in the intestine. Okay. So after mechanism also, this drug is secreted in the intestine. From that intestine, it is reabsorbed. It is again reabsorbed. Will go to the liver. Will be metabolized. Okay. Will be again excreted in the GIT and some part will be also again reabsorbed. So होता क्या है कि digitoxin लेने के बाद में absorption होने के बाद में intestine से क्या होगा पहले? So it will be absorbed from the intestine. It will go into the systemic circulation. Okay. It will some part of it will be metabolized. It will show the action and metabolized. Okay. Then okay, the metabolites are also again secreted in the intestine. Metabolites, okay. For example, digitoxin. So this digitoxin का tablet लिया आपने, so that will be absorbed. It will be distributed. It will show its pharmacological action and it will be metabolized. And metabolites, इसका metabolism होता है digoxin में. Its metabolite is the digoxin. Okay. Now this digoxin will it will actually secreted from the blood to the intestine. From intestine it will be again reabsorbed. It will again go to liver for metabolism and action. So that's why because of this there is a long duration of action of this digitoxin. And this cycling किसका? This cycling known as a enterohepatic cycling, because ये ड्रग क्या होता है? इंटेस्टाइन से एब्सॉर्ब होता है, ब्लड में जाता है, एक्शन दिखाता है, मेटाबॉलिज्म होता है, जो मेटाबोलाइट है वो फिर से इंटेस्टाइन में एक्टिवली सीक्रेट हो जाता है, फिर से इंटेस्टाइन से वो एब्सॉर्ब होगा कुछ कम अमाउंट में बट होगा, फिर से वो लिवर में जाएगा, ओके, बाइल एसिड में जाएगा, बाइल में सीक्रेट होगा, ठीक है, फिर से इंटेस्टाइन से एब्सॉर्ब होगा, ओके. सो लाइक दैट. So metabolites of this digoxin is excreted in the bile acid, and that bile acid is secreted in the intestine. Intestine में क्या होगा, फिर से उसका absorption होगा. So it is known as enterohepatic circulation. Enterohepatic circulation. समझ में आया ये? Yes. Enterohepatic circulation समझ लगा? सांगो परत. Enterohepatic circulation. ठीक है, परत पण आपण नंतर सांगूया. We have seen this part also. We have seen the different orders of elimination. So zero order of elimination. Some drugs are eliminated by zero order. Some drugs are eliminated by zero order. For example, यहाँ पे एक ट्रिक है जीरो वैट पावर. जीरो वैट पावर. सो yesterday मैंने बोला था आपको, अल्कोहल, ठीक है, वारफेरिन, ठीक है, थियोफाइलिन वगैरह, देन फिनिटोइन वगैरह, जीरो वैट पावर. देन मोस्ट ऑफ द ड्रग्स आर एलिमिनेटेड. रिमेंबर, मोस्ट ऑफ द ड्रग्स आर एलिमिनेटेड बाय, जो मोस्टली जो ड्रग का एलिमिनेशन होता है, इट इज डन बाय फर्स्ट ऑर्डर एलिमिनेशन. मोस्ट ऑफ द ड्रग्स, यहाँ पे लिखता हूँ हम, most of the drugs eliminated by first order. What is zero order? A constant amount of drug will be eliminated regardless the plasma drug concentration. Plasma में drug कितना है, blood में drug कितना है, doesn't matter. Constant amount of drug will be eliminated. मतलब for example, in case of ethanol, say for example 20 milligram of drug will be eliminated. So total dose कितना है आपके पास, मान लीजिए यहाँ पे 600 में 600 है, 600. So out of 600, only 20 milligram drug will be removed per 100 ml per hour. 1 hour में सिर्फ 20 milligram ethanol remove होगा, ठीक है. So likewise that, okay? And after 1 hour, it is 20. So it doesn't matter how much the plasma concentration is. So this is known as a first order elimination, or it is known as a constant rate process. Zero order elimination is also known as a constant rate process. Constant amount of drug will be eliminated regardless its plasma concentration. Okay? So in zero order elimination you will get a straight line. In zero order elimination you will get a straight line. What is the equation for zero order elimination? dc upon dt. dc means decrease in the concentration with respect to time. dc upon dt means decrease in the concentration with respect to time is equal to minus k. Minus k is nothing but the rate constant, and el is for elimination rate constant. It is elimination rate constant. So you can see rate constant is not dependent on the any other term. Okay, so that's why it is zero order. So in this case, the kinetics of this zero order elimination does not depend on any factor. That's why it is a zero order. Now what do you mean by first order? First order means kinetics will depend on the one term. Okay, one reactant. देखा होगा आपने physical pharmacy. So when first order means reaction depends, or kinetics depends on the one term known as a concentration. Okay, अगर दो factors के ऊपर depend करते हैं तो second order elimination. Okay, so first order elimination is what? The amount of drug to be eliminated per unit time is proportional to the plasma drug concentration. A constant percentage of drug will be removed which is dependent on the plasma drug concentration. A constant fraction or constant percentage, यहाँ पे क्या है percentage, यहाँ पे देखो first order में क्या है constant fraction or constant percentage of drug will be removed. Here in zero order constant amount of drug will be removed. Amount, and that is unrelated to plasma drug concentration. Zero order में plasma drug concentration कितना है या फिर drug कितना है body में, doesn't matter. A constant amount will be removed. In the first order body में drug कितना है उसके ऊपर उसके proportion में कुछ percentage of drug will be removed. The percentage of drug will be removed which is proportional to the plasma drug concentration. So that's why in the first order dc upon dt is equal to minus ke minus kel c. So c is nothing but the concentration. So in the first order elimination rate constant depends on the concentration of drug in the blood, that is the plasma drug concentration. Okay, so most of the drugs are eliminated by first order. Remember, most of the drugs are eliminated by first order. Okay, most of the drugs eliminated by first order. Okay, and first order will have one characteristics. So T half, first order T half. T half is a most important characteristic of first order. इसके ऊपर क्वेश्चन आ चुका है कि half life. T half is also known as a half life. Half life. What do you mean by half life? What do you mean by half life? T half is also known as a half life. Half life. What do you mean by half life? So suppose that your blood as a concentration. Okay, suppose that जैसे आपने absorb किया ऐसा अपने ग्राफ देखा है ऐसा. Okay, so suppose that this is known as Cmax. This point is known as a Cmax. Okay, that okay, half life means what? The time span or the time interval or the time required to decrease the Cmax by 50%. So to decrease the maximum, okay, to decrease the highest amount of drug in body by its 50%, known as a half life. Okay? And this is very very important characteristic of first order elimination. इसके ऊपर क्वेश्चन आ चुका है. Okay, now again we are going to see this same thing. Don't worry about that. Okay, so I already explained this, so I'm not going to explain you again. Told you 2-3 times this. Dose adjustment definition. Median lethal dose means a dose of drug which can kill 50% of population. A dose of drug in a milligram per milligram per kg, which is able to kill the 50% population, known as the LD50. Okay, medium lethal dose, right? Medium lethal dose, known as the LD50. A dose of drug which can kill 50% population. Okay, 50% population. Medium effective dose means a dose of drug milligram per kilogram which will give you desired pharmacological effect in a 50% of population. Desired pharmacological effect मतलब क्या? So beneficial effect in the 50% population. So effective minimum effective medium effective dose known as the ED50. LD50 50% population में ये dose kill करेगा. So dose required to kill the 50% of population known as the LD50, and ED50 means dose which are effective in the 50% population. So ED50, and the ratio of LD50 to the ED50 is known as the therapeutic index. Therapeutic index क्या है? Ratio of LD50 and ED50. Medium lethal dose 50 LD50 divided by ED50. The ratio of these two is known as the therapeutic index. Don't get confused with the therapeutic range, therapeutic window, and therapeutic index. Therapeutic index is another term. Therapeutic window is another term. Therapeutic range or therapeutic window. क्या होता है वो? So the concentration range between minimum effective concentration and maximum safe concentration. That is known as therapeutic index, therapeutic range, or therapeutic window. इसको therapeutic window भी बोलते हैं, और therapeutic range or window. It is the concentration range. But what is therapeutic index? It is the ratio. ये क्या है? Ratio of LD50 divided by ED50. Ratio of LD50 divided by ED. Therapeutic index is a measure of safety of drug. इसके ऊपर भी क्वेश्चन आ चुका है. What is therapeutic index? So therapeutic index will measure as safety of drug. A drug having wide therapeutic index or large therapeutic index is much safer drug. If drug is having narrow therapeutic index, that drug is a very unsafe, or it is not safer. The margin of safety is less. So therapeutic index is a measurement, or therapeutic index is a determinant for margin of safety. यहाँ पे याद रखो margin of safety. यहाँ पे yes लिखा है, पहले हम भी लिखते हैं margin of safety. So therapeutic index will decide the margin of safety. So low therapeutic index means low margin of safety. High therapeutic index means the high margin of safety. Is that clear? We have seen zero order kinetics. Zero order kinetics means constant rate process, and this the rate does not depend on the concentration of reactant or any other factor. Okay, so in this case dc upon dt, यहाँ पे इसका इक्वेशन ये है, dc upon dt is equal to kc. इसका हाफ लाइफ होता है 0.693 डिवाइडेड बाय k, 0.693 डिवाइडेड बाय k. और जो फर्स्ट ऑर्डर होता है एलिमिनेशन, फर्स्ट ऑर्डर काइनेटिक्स, तो इसमें फर्स्ट ऑर्डर इन द फर्स्ट ऑर्डर काइनेटिक्स द रेट इज डायरेक्टली proportional to the concentration of one component undergoing the reaction. Or you can say in the first order kinetics the rate of kinetic depend on the one factor. Okay, either it may be concentration or temperature. It is a first order kinetic is known as linear kinetics. First order kinetic is known as a linear kinetics, right? So इसका इक्वेशन होता है dc upon dt. इक्वेशन अल्टरनेट चेंज हो गया है, dc upon dt is equal to k0c. It is the first order equation. इसका half life. Mixed order kinetics, that means mixed order kinetics, they are described by Michaelis-Menten equation known as a non-linear kinetics. So we are going to see this, don't worry about. When I will explain you the chapter known as a chemical kinetics, at that time you will be able to understand all these. So यहाँ पे एक बार क्वेश्चन आया था, मिक्स ऑर्डर काइनेटिक्स आर इनोलियन. Remember, mixed order kinetics are observed in absorption of vitamin C, distribution of naproxen, and elimination of riboflavin. Most of the drug will follow first order kinetics. Remember, okay? Zero order kinetics का example बोला है मैंने, जैसे अल्कोहल हो गया, एंटीपायरिन हो गया, ओके, फेनेटाइन हो गया, ठीक है. So examples. And mixed order का vitamin C, naproxen, riboflavin. Okay. So I will explain you some things from book. So elimination. Okay. So what do you mean by elimination? It is nothing but the last component of your kinetic process. जो kinetic process है आपका ADME, absorption, distribution, metabolism, elimination. So last component of your pharmacokinetics. Okay, it is nothing but the process whereby drug is removed from the body, okay, after producing its pharmacological action, with or without metabolism. Most of the drugs are removed after metabolism. Most of the drugs का है कि most of the drugs are eliminated from body after metabolism, but some drugs are removed unchanged. Okay, remember. Okay, and some drug will be removed unchanged. Some drug will not follow this process. Means some drug will not get metabolized. They will be removed as such. For example, digoxin, ephedrine, okay, practical and inhalation anesthetics. ये जो drugs है, okay, ephedrine, digoxin, okay, then practical, then inhalation anesthetics. So these drugs, they are removed from body without metabolism. So they will not undergo metabolic reaction. Okay, right here. Now order of kinetics. There are two kinetic processes during the movement of drug molecule from one side to another side. So metabolic change it may follow. Okay. So elimination kinetics are of two types: first order kinetics and zero order kinetics. Okay. So first order kinetics मतलब what? It is known as exponential clearing or exponential removal. Exponential removal. So first order में क्या होता है? A constant fraction of drug is eliminated per unit time, which is a proportional to the plasma drug concentration. Proportional to the plasma drug concentration. यहाँ पे आपको समझना है. First order kinetic means what? It is nothing but the first order kinetic means a constant percentage, constant fraction or constant percentage of drug is eliminated per unit time, which is a proportional, which is a dependent, which is a directly proportional to the concentration, or that is known as plasma drug concentration. प्लाज्मा में कितना ड्रग है उसके अकॉर्डिंगली उसका परसेंटेज रिमूव किया जाएगा पर यूनिट टाइम. कांस्टेंट फ्रैक्शन और कांस्टेंट परसेंटेज ऑफ ड्रग विल बी रिमूव्ड पर यूनिट टाइम which is dependent on plasma drug concentration. ये टर्म याद रखो, which is dependent on plasma drug concentration. So first order kinetics, they are known as exponential clearing. और second होता है zero order kinetics. So it is known as a linear kinetics or linear clearing. Constant amount of drug, constant quantity मतलब वही ना amount, constant amount or constant quantity of drug will be eliminated per unit time. Now in this case, regardless or independent of the plasma drug concentration. फर्स्ट ऑर्डर में क्या है कि जो परसेंटेज रिमूव हो रहा है पर यूनिट टाइम और परसेंटेज रिमूव हो रहा है ड्रग का पर यूनिट टाइम, so that is a dependent on the plasma drug concentration. और जीरो ऑर्डर में क्या है, a constant amount of drug is eliminated which is not dependent on the plasma drug concentration. मतलब प्लाज्मा में कितना ड्रग है कुछ लेन देन नहीं, that is zero order. Okay? So I will explain this for example. Okay, for example, if you consider a 0 hour, okay, a dose of drug is 1 gram. Okay, 1000 milligram drug है यानी 1 gram drug है. So if dose of drug is 1000 milligram or 1 gram at a 0 hour, मतलब अभी दिया है drug. Okay, so okay, consider that a 0 hour drug was given 100 mg, 1000 mg in a body and it follows first order. अगर drug first order elimination follow करता है, it follows the first order kinetics and rest. Okay, that is nothing but the constant fraction. कितना, for example, say for 10%, constant percentage of drug will be removed per unit time, right? So say for example 10%. ठीक है, यहाँ पे क्या example दिया है. So dose of drug is nothing but the 1000 mg. If that drug A, एक example ले लो, drug A is given and it follows the first order. If it follows the first order kinetic, in that you know that a constant fraction of drug will be known. Constant fraction, that is a, for example, 10% drug is removed. Okay, 10% drug is removed or filtered through kidney. Okay. Now at the end of first hour, अभी ड्रग दिया आपने 1000 मिलीग्राम और आपको मालूम कि 10% ड्रग का रिमूव हो जाएगा और ये फर्स्ट ऑर्डर से एलिमिनेट होता है. तो समझने के लिए एग्जांपल है. ठीक है. So if drug follows the first order kinetic elimination kinetics and dose of drug is 1000 milligram and constant percentage, that is 10% of drug is removed every hour. हर आवर में क्या होगा 10% ड्रग रिमूव. नाउ इन द फर्स्ट आवर व्हाट विल बी द कंडीशन इन द फर्स्ट आवर. सो टोटल ड्रग कितना आपके बॉडी में 1000 mg. ओके. सो एलिमिनेशन हो रहा है मतलब वो माइनस करना पड़ेगा. सो आउट ऑफ 1000 mg व्हाट इज एलिमिनेटेड. सो माइनस 1000 इंटू 1/10. 1/10 क्यों है 10%. ठीक है. वो 10% मतलब क्या है 10% मतलब क्या है. ठीक है. 10% मतलब 1/10 ना. 10% कैसे लिखे हैं 10 इंटू 1/100. सो 10/100 1/100 सॉरी 1/10. तो 10% कैसे लिखते हैं राइट. वैसे 1/10. सो 1000 इंटू 1/10. सो इट विल कम टू 1000 माइनस 100 कैसे है यहाँ पे देखो 1/10 मतलब 10 है तो उसका जो पूरा इधर भी क्या करना पड़ेगा उसका इक्वलाइज करना पड़ेगा. जब उसको सॉल्व करेंगे 1000 इंटू 1/10 दैट विल कम टू 900. ठीक है. वैसे ये पूरा इसका जो है ना वो आएगा आपका 100 mg. वैसे फॉर एग्जाम्पल 1/10 इंटू 1000 है तो यहाँ पे डिनोमिनेटर में 10 है तो इधर भी 10 करो. 10 ऊपर भी 10 नीचे भी 10. तो इसका आएगा 100. टोटल कैलकुलेशन करके आता है 100. सो 1000 माइनस 100 900 mg मीन्स एट 1 आवर 900 mg ड्रग विल बी रिमेंड. तो 10% ड्रग रिमूव होगा मतलब 900 mg रहेगा. नाउ एट द सेकंड आवर थर्ड आवर एंड फोर्थ आवर. पहले आवर में क्या है 10% ड्रग रिमूव हुआ है. 1/10 मतलब वही कि 10/100. 1/10 मतलब क्या 10/100 ही है 1/10. इसको ऐसा लिखा 10% मतलब क्या है 10 आउट ऑफ 100. 10 आउट ऑफ 100 ऐसा लिखा. ये 0 कट आएगा कितना 1/10. तो 1000 mg ड्रग है आपकी बॉडी में तो उसमें का वो फर्स्ट ऑर्डर एलिमिनेशन फॉलो करता है. इट विल फॉलो फर्स्ट ऑर्डर एलिमिनेशन. हाउ मच ऑफ ड्रग विल बी एलिमिनेटेड और हाउ मच ऑफ ड्रग विल बी रिमेन इन द बॉडी आफ्टर 1 आवर. अमाउंट ऑफ ड्रग इन द बॉडी इज इक्वल टू दैट इज 1000 mg माइनस 1000 इंटू 10% जो फ्रैक्शन रिमूव हो चुका है. रिमूव क्यों हुआ है ना रिमूव हो चुका है. रिमूव हुआ मतलब माइनस करना पड़ेगा. एब्सॉर्ब हो गया मतलब प्लस करना पड़ेगा. तो 1/10 so it will come to 900 mg. Now at the second and third and fourth hour क्या हुआ. So now second hour देखो अभी बॉडी में ड्रग कितना है 900 mg राइट. so 900 mg माइनस एलिमिनेशन किससे होगा वो 900 mg का ही होगा ना. आपके बॉडी में पहले 1000 mg था. पहले आवर में क्या होगा 1000 mg में से ड्रग एलिमिनेट होगा. उसमें हुआ है 100 mg एलिमिनेट बचा 900 mg. सो अभी जो सेकंड आवर में एलिमिनेशन होगा तो वो 1000 mg से कैसे होगा वो 900 mg से होगा. आपके बॉडी में अभी 900 mg ड्रग है. तो 900 माइनस 900 इंटू कितना ड्रग रिमूव होता है हर प्रति आवर. सो एवरी आवर 10% ऑफ ड्रग इज रिमूव. तो 900 माइनस 900 इंटू 10/100 और ये 10/100 और इसको आप 1/10 भी बोल सकते हो सेम थिंग. सो अगेन इसको सॉल्व करेंगे आप. ठीक है. ठीक है. ये जीरो उसका ये दोनों का 0 कट जाएगा. 9 इंटू 10 90 900 माइनस 90 810 mg. तो सेकंड आवर में फिर से 10% ड्रग रिमूव हुआ तो आपकी बॉडी में बचेगा 810 mg. इन द थर्ड आवर तो ना आपकी बॉडी में कितना ड्रग है 810 mg. 810 माइनस कितना रिमूव होगा फिर से 10%. तो 810 इंटू 10% 1/10 और 10/100. सो अगेन इट विल अगेन आप कैलकुलेट करोगे तो ये दोनों जीरो जाएगा. 81 इंटू 10 कितना होगा 810 और फिर से एक जीरो जाएगा 81 तो 810 माइनस 81 इट विल कम टू 729 mg. ठीक है. ये होगा थर्ड आवर. फोर्थ आवर में क्या होगा आपके बॉडी में अभी ड्रग कितना है 729 mg. 729 mg माइनस कितना ड्रग कम हो रहा है 10%. तो उसका 10% कर दो 729 माइनस 729 का 10% होता है 72.9. तो उसका माइनस कर दो 729 से 72.9 651 mg. So fourth hour constant percentage of drug will be removed. समझ में आ रहा है या नहीं? ठीक है, पहले क्या है आपके बॉडी, so your body has a 1000 mg drug. Okay, now suppose that it follows a first order kinetics, it follows a first order kinetics, right? So first order kinetics means what? Constant percentage of drug will be removed which is dependent on the plasma concentration. So for example, now in the first hour, okay, after the given drug first hour में कितना eliminate होगा? In the first hour, so total drug in body is 1000 mg. now इसका 10% कम हो जाएगा, minus 10%, minus 1000 into 1 by 10 or 1 by 10 or 10 by 100, same thing, 10 by 100. So it will come to 100 mg. Okay, 100 mg, 1000 mg minus 100, so 900 mg. So in the first hour 100 mg will be eliminated, so your body will have 900 mg drug. Now at the second hour, at the third hour, and at the fourth hour of elimination, because every hour 10% drug is being eliminated, right? Now at the second hour, so total drug in your body is 900 now. Okay, 900 mg, 900 minus 900 into its 10%. Okay? So 900 into 10 by 100, so it will come to again 90 mg. So again 900 minus 90, 810 mg. So at the end of second hour, 2 hour के बाद में आप, so after 2 hours your body will have only 810 mg of drug. Again for third hour, so now you will have 810 mg of drug in body. So 810 minus, okay, रिमूव हो रहा है, कितना रिमूव हो रहा है? 10%. इसका 10%, 810 mg का 10%. So 10% of 810 mg will be removed from 810 mg, right? So because that is the total drug in our body now. Okay, so if you calculate this, so it will come to 81 mg. 81 mg. So 810 minus 810 minus 81, 729 mg. So now this is the amount of drug in your body. Okay, this is the condition for third hour. Now fourth hour 729 minus इसमें से कितना होगा? 729 का 10%, कितना आता है देखो, 729 का 10% आता है 72.9. so just minus that from original value 729, so it will come to 656.1 mg. so at the fourth year, so it is known as exponential kinetics. exponential kinetics, okay? जो आपको प्लाज्मा ड्रग है उसका constant percentage removed. So if you, okay, now if any drug follows zero order kinetics, if any drugs follows zero order kinetics, for example, same example take, suppose that a drug is given in a 1000 mg dose, 1000 mg dose है एक ड्रग का वो दिया है and it follows a zero order kinetics. Suppose if drug is given 1000 mg and it follows zero order kinetic, ये क्या करता है? zero order kinetic follow करता है. So that is nothing but the, इसका मतलब क्या है? What is the meaning of zero order? A constant amount of drug will be removed regardless is plasma concentration. मतलब every hour a particular amount drug will be removed. For example, if take example, if 10 mg of drug is removed per hour, in the first hour 1000 mg minus 10, 990 mg. Second hour 990 minus 10, 980 mg. Third hour 980 minus 10, 970 mg. Fourth hour 970 minus 10, 960 mg, and so on. So you are going to get a straight line like this. So this is known as a linear kinetics. Zero order kinetics are known as a linear kinetics. In case of first order में कैसा होगा kinetics? First order में देखो, first order में kinetics ऐसा linear नहीं है, वो कैसा आएगा? ये ऐसा आएगा. That is the graph for first order. Is that clear? Clear or not? Clear हो गया नहीं? Yes, anybody? Yes. हो गया clear नहीं? बोलो. So drug eliminated by two ways. First it will be metabolized and then it will be excreted. Okay? So there are the drugs are eliminated by two ways. Okay? First drug will be metabolized and it will be excreted, but it is not a case always. Some drugs are not metabolized in the body and they are eliminated as such, but most of the drugs they are metabolized and then they are eliminated. Remember, okay? So difference between first order and zero order kinetics. Okay? So definition, you know that. What is the definition? In the first order, a constant percentage of drug will be removed which is proportional to the plasma concentration, and in the zero order, constant amount of drug is removed which is independent on the plasma concentration. Okay? Now rate, okay, definition हो गया. Rate of elimination क्या है? In case of first order, Rate of elimination is proportional to the amount of drug in the body, means plasma drug concentration. So rate of elimination is dependent on the plasma drug concentration in case of first order. In case of zero order, it does not depend on the plasma drug concentration. It does not have such relation. Right? Now, drug metabolizing enzyme. Okay. So in case of first order kinetics, drug metabolizing enzyme remains unsaturated, but in case of zero order, they become saturated. So that constant amount of drug is removed currently. Okay. Now you will get a graph known as exponential curve. In case of zero order, you are going to get linear curve. Example: most of the drugs they will follow first order kinetics, elimination kinetics, and zero order zero watt bulb. I have told you in the last lecture. So like alcohol, phenytoin, warfarin, and all that. Okay. Then other, what is the another name for first order kinetic? So it is also known as a rate. Okay. Flow limited excretion. It is also known as a flow limited excretion, and zero order is known as a capacity limited excretion. Capacity limited excretion. So elimination. Okay. So in elimination that occurs in the different stages. This is the urine formation occurs in the three steps: glomerular filtration, then tubular secretion, and passive reabsorption. We have seen, you might have seen in the urinary system in the 12th process of urine formation. So metabolism and excretion, they together constitute the elimination. Three processes are involved in the renal excretion of drug. First process is nothing but the glomerular filtration, which is a passive glomerular filtration, so which is directly proportional to the excretion. Second होता है active tubular secretion, which is inversely proportional to the excretion. तीसरा होता है passive tubular reabsorption, which is again directly proportional to the excretion. तीन point है, you have to remember. Now in case of alkaline drug जो है they are excreted to a greater extent in the acidic urine. अगर कोई basic drug है तो acidic urine में उसका क्या होगा, excretion होगा. So alkaline drug are excreted in the acidic urine, right? Acidic urine, because alkaline drug will be ionized rapidly in case of acidic urine. So percentage ionization depends on the pH and pK of drug we have seen. So in the acidic urine, alkaline drugs they are more ionized and they are easily excreted. If the urine is made alkaline, if the urine is alkaline in case of acidic drug, अगर एसिडिक ड्रग है और यूरिन क्या है अल्कलाइन है तो क्या होगा, एसिडिक ड्रग का आयोनाइजेशन होगा, एसिडिक ड्रग भी रिमूव किया जाएगी. So that's why in case of poisoning of basic drugs, you have to acidify the urine to remove the drugs or to increase the elimination of that drug. If you have overdose or poisoning of acidic drug, so you have to alkalize the urine so that there will be more excretion of that drug. Okay? So administration of sodium bicarbonate. Sodium bicarbonate is a urinary alkalizer. Is therapeutically useful strategy for management of both either type of poisoning, both type of poisoning. ये समझ में आया क्या ये पूरा? Yes or no? Elimination. Now we'll see the next part known as the mechanism of drug. So now this is nothing but the mechanism of prolongation of action. How you can enhance the duration of action of drug. Okay, methods to prolong the action of drug. तो आप how you can increase the duration of action of drug कैसे? Okay, so process, you can alter the different process. So for example, here in the first column process, in the second column method and third column examples of drug. Okay, तो पहले कॉलम में दिया है प्रोसेस, कौन सा प्रोसेस आपको आपको चेंज करना है, अल्टर करना है. यू कैन अल्टर द प्रोसेस. कौन सा मेथड है, एग्जांपल्स क्या है उसके. सो यू कैन डिक्रीज द ओरल एब्सॉर्प्शन. So if you want to get a sustained action, you can decrease the oral absorption by providing the drug sustained release preparation. By providing the drug in a sustained release preparation or by coating with the polymers or resin. For example, iron and theophylline or deripyllin. Deripyllin मतलब theophylline. Now, in case of parenteral formulations, how you can enhance or how you can increase the duration of action of that product by reducing the solubility. जैसे एक्वियस soluble है तो वो जल्दी एब्सॉर्ब होगा, बट उसको ही ऑयल में डाल दिया, डेपोट प्रिपरेशन, सो what will happen, it will increase the duration of action. For example, penicillin is a water soluble, it has a very, it's उसका absorption जो है जल्दी हो जाता है, पेनिसिलिन का absorption. Now penicillin when come, okay, penicillin plus procaine penicillin, they are combined together for the sustained action. Then oily preparation, for example, oily suspension, depot progesterones. So depot progesterones मतलब ये progestin slowly release किया जाएगा due to oil, okay? Altering the particle size, okay, particle size as large crystal that are slowly absorbed. Particle size जो है, smaller particle size क्या होगा, जल्दी absorb होगा, larger particle size slowly drug release करेगा. So insulin, because insulin has a very short half-life, it has a short duration of action. So insulin is combined with the zinc and suspension is made. So it will alter the pharmacokinetic parameter. It will increase the duration of action of insulin. Then again platelet, okay. Then pellet implantation, okay, pellet implantation. Then salicylistic capsules. ये क्या करेंगे, slowly drug release करेंगे. For example, testosterone का है. Then reduction in the vascularity, जो ब्लड वेसल है उसको सप्लाई डेट, ज्यादा ब्लड वेसल सप्लाई तो एब्सॉर्प्शन ज्यादा होगा, ठीक है. ब्लड वेसल अगर कम होगी तो एब्सॉर्प्शन कम होगा. सो यू हैव टू डिक्रीज द vascularity so that you can enhance the duration of action. So in case of adrenaline and lignocaine is a local anesthetic, okay, so it has a very short half life, right. It is intermittent acting, right? To enhance the duration of action, adrenaline is gone. Adrenaline क्या है, it is a vasopressor, ये blood vessel को constrict करता है, okay? That's why it will decrease the vascularity, okay? Because of the constriction of blood vessel, so absorption of lignocaine will be increased for longer time, and due to that duration of action will be longer. Then again next, combining drug with the protein. So if you made a complex of drug with the protein, आपका body का ही protein ले लो कोई. So if you made a complex of drug with the protein, so that protein will slowly dissociate that drug, will slowly release that drug. So there will be increased duration of action. For example, in case of protamine, zinc, insulin. Then insulin क्या है? It is a very rapid acting, rapid acting and short duration of action. To increase the duration of action, so it is combined with the protamine. Protamine क्या है? It is a protein. Protamine, zinc, insulin suspension. So it has a sustained action or it has a longer duration of action. So alteration of chemical form of drug. You can alter the chemical form of drug. जैसे आपके पास में पैरास्टामोल है, so उसका एक ईस्टर बना दो. ईस्टर बनाएंगे तो क्या होगा, पहले तो वो बॉडी में जाएगा, वहाँ पे हाइड्रोलिसिस होगा उसका, बाद में एब्सॉर्ब होगा. So it will increase the duration of action. Okay. So chemical alteration, there is a esterification. For example, esterification in case of estrogen, okay, testosterone, okay, like that. Then ये हो गया आपका parenteral. How to increase the duration of action of drug given by parenteral route. Okay. How to increase the duration of action by drug given by oral route, we are seeing. Now how to increase the duration of action when drug is given by dermal route. Interdermally अगर देंगे तो उसका कैसे करेंगे, dermal route. Transdermal adhesive patches, transdermal adhesive patches, by forming a drug with the transdermal adhesive package. Okay, so in that case you have to use polymer. Drug will be released slowly from that polymer. So in case of scopolamine patches, scopolamine का क्यों use करते हैं? Scopolamine is used in the vertigo and nausea vomiting. So for a longer period it will be released. Then you can also form a ointment with the polymers like nitroglycerin. Nitroglycerin का भी duration of action बहुत ही short होता है. So okay, then Occuzerd मतलब ये क्या है? Occuzerd, it is used in the eyes. जिसका eyes dry होता है ना, उसके लिए Occuzerd एक drug derivative में, in that hydroxypropyl cellulose is there, so that will keep your eye lubricated for longer period of time. You can also increase the duration of action by altering the distribution process. So जैसे if protein is a very less bound to plasma protein, so क्या होगा उसका, so it will be absorbed and it will be distributed. Okay, it will be distributed, it will be metabolized faster. But if you increase the protein binding of drug, what will happen? So same drug, it binds protein to a more extent. So what will happen? So it will be not a free immediately for pharmacological action for elimination metabolism. So by choosing a more protein bound member of group, से दो तीन मेंबर है जैसे डाइजेपाम, लोराजेपाम, टेमाजेपाम, उसमें का अगर आपको लॉन्गर ड्यूरेशन एक्शन चाहिए तो यू कैन चूज द मोर प्रोटीन बाउंड ड्रग फ्रॉम दैट फैमिली. सो एग्जांपल है इसका, फॉर एग्जांपल ये सल्फेम थायरॉक्सी पिरिडाजिन, सल्फेम थायरॉक्सी पिरिडाजिन, और यू कैन आल्सो अल्टर द मेटाबॉलिज्म. फॉर एग्जांपल यू कैन इंक्रीज द ड्यूरेशन ऑफ एक्शन ऑफ ड्रग. अगर ड्रग जो है वो मेटाबोलाइज होता है जल्दी, ठीक है, उसका मेटाबॉलिज्म जल्दी होता है तो उसका ड्यूरेशन ऑफ एक्शन कम रहेगा. बट हाउ यू कैन इंक्रीज द मेटाबॉलिज्म ऑफ, हाउ यू कैन एनहांस द एक्शन और हाउ यू कैन इंक्रीज द ड्यूरेशन ऑफ एक्शन? जस्ट सप्रेस द मेटाबॉलिज्म. जो मेटाबॉलिक एंजाइम है उसको इनहिबिटर जो है ना, एंजाइम माइक्रोसोमल एंजाइम इनहिबिटर्स, so use the drug with a microsomal enzyme inhibitor so that the metabolism of that drug will not be there quickly and it will show longer duration of action, for example. Okay. So metabolism, inhibiting the metabolizing enzyme, inhibiting the metabolizing enzyme, for example. So if you want to enhance the acetylcholine level, so acetylcholine is metabolized by one enzyme, so cholinesterase. Cholinesterase inhibitors are used, for example pycostigmine. It prolong the action of acetylcholine. Pycostigmine क्या है? It is a cholinesterase inhibitor. Cholinesterase ये जो एंजाइम उसको इनहिबिट करता है. cholinesterase क्या करता है? It will hydrolyze the acetylcholine molecule. So cholinesterase क्या करेगा? cholinesterase pycostigmine क्या करेगा? It will bind to cholinesterase, will inhibit it, and because of that acetylcholine will perform for longer period. So by altering the metabolism you can increase the duration of action. Again by altering the excretion of drug you can also enhance the duration of action. तो एब्सॉर्प्शन रोक दो उसका, धीरे धीरे करो तो ड्रग बहुत देर तक काम करेगा. पेरेंट्रल में भी वैसे है. पेरेंट्रल में क्या, एक तो उसका क्रिस्टल, बड़े क्रिस्टल यूज करो या फिर उसका ऑयली फॉर्म में डाल दो उसको ताकि वो स्लोली काम करे, या फिर कोई प्रोटीन के साथ में कॉम्प्लेक्स बनाओ. नाउ इन केस ऑफ एक्सक्रीशन, competition of same transport system for renal tubule. Okay. So if two drugs are excreted by same transport system in the kidney, अगर किडनी में कोई ट्रांसपोर्ट सिस्टम है एक्टिव सिक्रेशन के लिए, जैसे होता है पेनिसिलिन, ओके, एंड प्रोबेनिसिन. प्रोबेनिसिन जो होता है, सो प्रोबेनिसिन is also actively secreted and penicillin is also actively secreted. So what happens, propenicillin will compete for the elimination. So instead of penicillin, propenicillin will be excreted. So propenicillin is combined with the that penicillin and ampicillin to increase the duration of action of penicillin. ठीक है, तो आप ड्रग को प्रोलॉन्ग एक्शन कैसे कर सकते हो? हाउ यू कैन इंक्रीज द ड्यूरेशन ऑफ एक्शन ऑफ ड्रग्स? ओके, by altering the absorption kinetics or by altering the distribution kinetics or by increasing or decreasing the metabolism or by using competitive drug at the same transport system. These are the different methods to increase the duration of action. इसमें किसी को कोई डाउट है क्या? Yes, anybody has doubt in this? Okay, now we'll see the pharmacodynamic part, receptors mechanism, receptor mechanism and related terms. Again this is very important part, question इसके ऊपर आता है. So first of all, mechanism of drug action, how drug will produce its action on body. So what is drug basically? Drug का definition क्या है? Okay, as per the WHO मतलब World Health Organization. So as per the WHO, drug is any chemical, drug is any chemical or it is a agent, chemical or agent which is used to diagnose. आपको यहाँ पे टर्म याद रखना है. फर्स्ट टर्म इज डायग्नोज, एजेंट और द केमिकल यूज्ड टू diagnose, to treat, then to mitigate, M, and prevention, P. Okay, a chemical agent which is used to diagnose the disease or for the treatment of disease or for the mitigation or for the prevention of disease, known as a drug. Drug is nothing but the chemical or agent which is used in the prevention, mitigation, treatment and diagnosis of disease in humans or in the animals, that is known as a drug. Drug का standard definition. Okay? Now mechanism of action of drug. How drug will alter the physiological process. Okay? Suppose you are suffering from diabetes. Diabetes मतलब क्या? Blood sugar का level बढ़ गया, blood sugar level. So if you increase the blood sugar, how you have to decrease that up to normal? So how drug will decrease? So but okay, different drug will act by a different way. So mechanism of drug action, drug कैसे कैसे काम कर सकता है? Mechanism of drug action, how drug can alter the physiological status of your body, alter the physiological status, जो pathological है उसको correct कैसे करें? So mechanism of drug action. Okay, a drug may act by stimulation. A drug may act by stimulation. A particular drug may increase the activity of particular system. अगर आपके एक पर्टिकुलर सिस्टम है, जैसे हार्ट है, आपका हार्ट, कोई ड्रग अगर हार्ट रेट बढ़ा रहा है मतलब क्या, इट इज अ कार्डियक स्टिमुलेंट. कोई ड्रग अगर फोर्स ऑफ कॉन्ट्रैक्शन बढ़ रहा है मतलब क्या, कार्डियक स्टिमुलेंट. सो ए ड्रग में एक्ट बाय स्टिमुलेटिंग ए पर्टिकुलर सिस्टम. फॉर एग्जांपल ये तो हार्ट का हो गया, अभी नर्वस सिस्टम. इफ ए ड्रग स्टिमुलेट योर नर्वस सिस्टम is known as a stimulant, seen as stimulant. If a drug depresses your nervous system, known as seen as depressant. Okay. So drug may act by different mechanism. First one is stimulation. So it may increase the activity of particular system. For example, adrenaline will stimulate the heart. Adrenaline will stimulate the heart. Okay. Again, a drug may act by depressing the particular system. A drug may act by stimulating the particular system. For example, adrenaline will stimulate the heart. A drug may act by depressing the particular system. For example, this quinidine will depress the heart. Morphine will depress the CNS. Okay. Stimulation मतलब क्या? Stimulation means increase in the activity of particular system. डिप्रेशन मतलब क्या, डिक्रीज इन द एक्टिविटी ऑफ पर्टिकुलर सिस्टम. सीएनएस का एक्टिविटी डिक्रीज हो गया तो क्या होगा, डिप्रेशन हो जाएगा. सीएनएस का एक्टिविटी बहुत ज्यादा स्टिमुलेट हो गया तो क्या होगा, आपको हेलुसिनेशन हो जाएगा, आपको सीजर्स आएंगे. ठीक है. सो अगर कार्डियक स्टिमुलेशन ज्यादा हो गया तो क्या होगा, ब्लड प्रेशर बढ़ जाएगा, हार्ट रेट बढ़ जाएगा. कार्डियक डिप्रेशन होगा तो आपको क्या होगा, टेकिकार्डिया होगा, सॉरी ब्रैडिकार्डिया होगा. कार्डियक स्टिमुलेंट देंगे, कोई ड्रग अगर कार्डियक सिस्टम को स्टिमुलेट करता है तो टैकीकार्डिया होगा, इट विल इंक्रीज द हार्ट रेट. कोई ड्रग अगर डिप्रेस करता है तो इट विल डिक्रीज द हार्ट रेट, सो ब्रैडिकार्डिया. सो लाइकवाइज दैट क्विनिडीन विल डिप्रेस द हार्ट. Quinidine is used in the cardiac arrhythmia. Then morphine is also drug which will depress your CNS. Okay. So drug may act by stimulation, drug may act by depression action, or drug may irritate a particular thing, okay, or particular area. For example, counter irritant. So you might have seen the term counter irritant. Okay. So irritation means drug may cause inflammation, corrosion, or necrosis of the cell. अगर कोई ड्रग ले लिया तो आपको corrosion होगा, inflammation होगा, या फिर आपका सेल का necrosis होगा. So that is the irritation. Drug may act by stimulation or by increasing the activity of particular system. Drug may decrease the activity of particular system, or drug may cause inflammation, corrosion, necrosis. That is irritation. Irritation. Or drug may act as a replacement therapy. Suppose if you have deficiency of endogenous chemical. Endogenous मतलब क्या, बॉडी के अंदर का केमिकल. Suppose if you have deficiency of vitamin B, okay, थायमिन का डेफिशिएंसी, विटामिन बी का डेफिशिएंसी, आपको विटामिन B1 का डेफिशिएंसी, या फिर आपको कौन सा भी विटामिन ले लो, विटामिन डी या फिर विटामिन ई. सपोज यू आर सफरिंग फ्रॉम द डेफिशिएंसी ऑफ दैट पर्टिकुलर विटामिन. सो व्हेन दैट विटामिन इज गिवन or when that vitamin is used, so it will act as a replacement. Okay, it will act as a replacement. So replacement, okay. Drug may act by stimulating a system, drug may act by depressing, or drug may act by irritating your skin or mucosa, or drug may act as a replacement. So for example, replacement of certain metabolites, vitamins in the particular deficiency. Now another, okay, drug may act by its cytotoxic action. Cytotoxic action. Cyto मतलब क्या, देखो, cyto is nothing but the cell. Cyto is the term for cell. Cyto is the term for cell. Cell मतलब अपना, cell मतलब आपको मालूम है, सेल मतलब पेशी. साइटोटॉक्सिसिटी मतलब क्या है, साइटोटॉक्सिक एक्शन. साइटो मतलब सेल एंड टॉक्सिक मतलब which is a toxic to the cell or which is able to kill the cell. Cyto means cell and toxic means killing. So antibacterial drug act as a cytotoxic for the microorganism. Okay. Anti-cancer drug will act as a cytotoxic for the cancerous cell. तो एंटीबैक्टीरियल जो ड्रग है, एंटीबायोटिक्स जो है, जो आपके बॉडी में इन्फेक्शन है, जो भी बैक्टीरिया है, फंगस है, वायरस है, उसका जो सेल है उसको किल करेगा. सो दैट्स व्हाई साइटोटॉक्सिक to the okay, to the microorganism. So antibiotics will be cytotoxic to the microorganism, right? Anti-cancer drug means what? They will kill the cancerous cell. Cancerous cell means your own body cell. So they are toxic to the cancerous cell. Cyto means cell, toxic means killing. So drug will kill. Drug may act by killing the particular cell. Okay. Stimulation, depression, irritation, replacement, cytotoxic. Okay. Now we'll see the next. Modification of immune system. आपको जो immunity है, so that will be modified. Some drugs act by modification of immune system. For example, immunosuppressant. Okay, glucocorticoids and immunosuppressant. Glucocorticoids and immunosuppressant. How they will act? ये ड्रग क्या करेंगे? These drug will decrease your immunity. जैसे for example, suppose any kind of antigen is in your body, and in response to that antigen, what will happen? So that antigen will combine with the mast cell, okay, mast cell, and there is a degranulation of mast cell. There is a release of inflammatory chemicals known as a histamine, okay, histamine, then prostaglandin, then leukotrienes, okay, leukotrienes that may cause allergy, okay, inflammation, okay, allergy, inflammation, and asthma. So now glucocorticoids, what they do? They will suppress your immunity. Immunity matlab they will suppress the mast cell. There is no degranulation of mast cell. Mast cell will not recognize this antigen. Okay, and therefore there is no degradation, no release of these chemicals. So glucocorticoids, immunosuppressant. Immunosuppressant, when they are used, when immunosuppressants are used, do you know when they are used? Okay, so yes, organ transplantation. What happens if you want to replace your liver or kidney due to some ailments? Suppose you have liver cancer है आपको, या फिर liver cirrhosis है, आपने क्या किया, liver आपका निकाल दिया, दूसरा डाल दिया. So what happens, as that liver from another person, donor, so that has a different genetics, another person will have different genetics, so it have a different protein. Whenever that liver is transplanted into your liver, so what will happen? Liver is another foreign protein to your body. Okay, so your body will treat that liver as an antigen, and against that antibody will be produced, and there will be antigen antibody reaction, and your body will reject that organ. So your body will not accept the foreign protein. Okay, immunity reactions. Now in that case, immunosuppressant drugs are used so that they will suppress the immunity, and your body will accept that foreign organ. So immunosuppressant. Now a drug acts by this mechanism. Okay, now they drug act on, कहाँ पे act होते हैं? So drug act by, it may act via, drug act via through a receptor. Drug may act through a receptor. Okay, they may either stimulate receptor or they may be block the receptor. Okay, they may be either agonist, that means stimulation of receptor. They may be either partial agonist, means partial stimulation. They may be inverse agonist, stimulation but reverse action. Okay, or they may be antagonist, means block the receptor. So drug may act on receptor, drug may act on receptors, okay, in a different way. Drug may act on enzymes. So particular enzymes may be stimulated or may be inhibited. A drug may inhibit or stimulate the enzyme, or drug may alter the permeability of ions. Drug may alter the permeability of ions. So your cell membrane has a, or your plasma cell membrane has a different ion channels, like sodium ion channels, chloride ion channels, like potassium ion channel, calcium ion channel. So there is a increased or decreased permeability to these ions. Okay, so drug may act on receptor, drug may act on enzymes, drug may alter the permeability of various ions through the membrane. Okay, now drug may act by its physical action, or drug may act by its chemical action. Physical action से कैसे? For example, suppose you got a poisoning, food poisoning, या फिर आपने कुछ poison खा लिया, पी लिया. सर उसने मुझे बोला था कि झगड़ा हुआ है आपका, या फिर आपका कुछ आजकल जो है ब्रेकअप हो गए, वो हो गया, और आपके गुस्से में आके आपने कुछ खा लिया पॉइजन. सो पॉइजन खा लिए तो क्या होगा, सो इमीडिएटली आपको क्या देंगे, एक्टिवेटेड चारकोल. सो दे विल इमीडिएटली गिव यू एक्टिवेटेड चारकोल, सो दैट whatever poison is there in a stomach which is unabsorbed, कुछ अमाउंट तो एब्सॉर्ब होगा ही होगा आपकी बॉडी में, ब्लड में, वो बाद में उसका मेजर होता है. बट वट एवर unabsorbed poison is there, so that unabsorbed poison should not get absorbed. For that they are giving activated charcoal. Activated charcoal. They will give activated. Now this activated charcoal what will do? It will absorb all the unabsorbed poison. जो स्टमक में पॉइजन है जिसका एब्सॉर्प्शन नहीं हुआ है तो ये एक्टिवेटेड चारकोल के ऊपर एब्सॉर्ब हो जाएगा एंड इट विल प्रिवेंट इट फ्रॉम एब्सॉर्प्शन. सो एक्टिवेटेड चारकोल विल एक्ट बाय इट्स फिजिकल एक्शन. नाउ केमिकल एक्शन, ड्रग में एक्ट बाय इट्स केमिकल एक्शन. Chemical action is chelating agent like EDTA, etc. etc. Let's say, for example, if you are having iron poisoning, in that case, deferoxamine. Deferoxamine is a drug. Deferoxamine. That is known as an iron chelator. Suppose you are suffering from mercury poisoning, so EDTA, that is iron chelator. So drug may act by physical action, drug may act by chemical action, or drug may act by receptor, enzymes, pumps, or ion channels. Or drug may act by altering the metabolic process. Drug may act by altering the metabolic process. Drug may act by altering the metabolic process. Like lipolysis inhibit करने वाले drug. ठीक है, lipolysis inhibit करने वाले drug like that. Mechanism of drug action: most of the drug act by binding to a receptor protein, enzymes, or ion channels. They may also act on a cell membrane. They may act also on a cell membrane. सेल मेम्ब्रेन के ऊपर भी एक्ट कर सकते हैं, इनसाइड और आउटसाइड ऑफ द सेल, टू प्रोड्यूस देयर इफेक्ट. ओके, ड्रग में मोस्ट ऑफ द ड्रग एक्ट बाय बाइंडिंग टू ए रिसेप्टर. रिसेप्टर इज नथिंग बट ए प्रोटीन इन नेचर, और मोस्ट ऑफ द ड्रग एक्ट बाय binding to a receptor protein or by binding to enzymes or ion channels. They may also act on a cell membrane inside or outside to produce the effect. Okay, now few basic mechanism of drug action. Okay? So via receptors, एक तो ड्रग क्या एक्ट होंगे, दे विल एक्ट वाया रिसेप्टर्स. दे मे एक्ट वाया एंजाइम्स. रिसेप्टर के ऊपर पूरा अपन देखने वाले, which drug will act on various receptor. Via receptor, for example, beta blockers, alpha stimulant, beta stimulant, proton pump inhibitors, etc. Via receptor. Now via enzymes and pumps, some drug may act via different enzymes and pump. For example, by inhibiting or stimulating the enzyme. For example, this allopurinol. यहाँ पे एक ड्रग दिया है allopurinol. This drug is known as it is used in the treatment of gout. So it is a inhibitor of xanthine oxidase. ये क्या है, एंजाइम है. So it will inhibit the xanthine oxidase and will prevent the synthesis of uric acid, which is a increased in case of gout. Gout में वो uric acid बढ़ता है. uric acid बढ़ गया तो वो सोडियम के साथ में, पोटेशियम के साथ में, कैल्शियम के साथ में salt बनाता है and crystal बनाता है. That crystal get deposited into your joints and causes joint swelling, pain. It is a gout. So allopurinol inhibit xanthine oxidase. Likewise, the acetazolamide. Acetazolamide एक drug है. It is a diuretic drug. ये क्या करेगा, यूरिन फॉर्मेशन इंक्रीज करेगा. So it is a carbonic anhydrase enzyme inhibitor. Carbonic anhydrase. ये मतलब चार्टेड अकाउंटेंट नहीं. Carbonic anhydrase inhibitor. Okay. Then ACE inhibitor drugs, proton pump inhibitors. Okay. Then cardiac pump inhibitor. That is known as a सोडियम पोटेशियम एटीपेस इनहिबिटर. इसका एग्जांपल होता है आपका डिगोक्सिन. सो ड्रग में एक्ट हुआ है रिसेप्टर, ड्रग में एक्ट हुआ है एंजाइम और डिफरेंट पंप्स, और ड्रग में एक्ट हुआ है डिफरेंट आयन चैनल्स. सर्टेन ड्रग्स विल स्टिमुलेट और सर्टेन ड्रग्स विल इंक्रीज द एंट्री ऑफ पर्टिकुलर आयन इन द सेल, और सर्टेन ड्रग विल ब्लॉक दैट पर्टिकुलर आयन. फॉर एग्जांपल यहाँ पे देखो कैल्शियम चैनल ब्लॉकर CCP. ठीक है, कैल्शियम चैनल ब्लॉकर लाइक वेरापेमिल, लिटियाजम, देन वेरापेमिल, लिटियाजम, देन आपका जो निपेडेपिन है, amlodipine है, all these are the calcium channel blockers. So what will they do? They will block the calcium channel present on the cell of cardiac cell जो होता है myocytes. So calcium channel blockers means they will block the calcium channel. When calcium will move inside the cell of myocardium, so that leads to contraction of myocardial cell. So ये prevent करेगा. Again, when calcium will move inside the blood vessel cell. So there is a constriction of blood vessel. So calcium channel blockers क्या करेंगे, blood vessel को dilate करेंगे, हार्ट को क्या करेंगे, ज़्यादा धड़कने नहीं देंगे, है ना. So they are used as antibiotics. In sodium channel blockers, so they will block the entry of sodium inside the cell. Sodium channel blockers. So drug may act via receptor, they may act via enzymes or different pumps, or they may act via alteration in the permeability of various ions. Okay. Or drug may act by its physical action, I have told you, or via chemical action. For example, oxidizing agent होते हैं KMNO4. It is a germicidal. It is a antiseptic. Germicidal KMNO4. तो ये germicidal effect और antiseptic effect कैसे करता है? Because of the its oxidizing property. ये क्या करता है? Oxidize करता है. Cellular content. जो बैक्टीरिया का सेल कंटेंट होता है उसको ऑक्सीडाइज करेगा. बैक्टीरिया का राम नाम सत्य via chemical interaction, right? Now by changing the metabolic process, so lipolysis increase करने वाले ड्रग, ठीक, by changing the metabolic process. जैसे इंसुलिन है, इंसुलिन will increase the glycolysis, so we have seen, okay, glucagon will increase the glycogenolysis. Now again you can see over here mechanism of drug action, ठीक है, ये टेबल इंपॉर्टेंट क्वेश्चन आ चुके हैं इसको. So physical action क्वेश्चन इसके ऊपर आ चुका है. एक्टिवेटेड चारकोल इन द पॉइजनिंग, एक्टिवेटेड चारकोल इन द पॉइजनिंग. आपने क्या किया, सर मला ती नाही म्हणली, काय सर मला ती नाही म्हणली, मग मला टेन्शन आलं आणि मी काय केलं, तर मग मी घेतली एंट्री, मतलब एंट्रल एंड्रल क्या एरंड्रोल पेस्टिसाइड. तर मग काय करायचं, मग ते ओके, आपको अगर किसी ने नहीं बोला है और आपने क्या किया, पॉइजन ले लिया, तो उसके बाद में आपको चारकोल देते हैं पहले पहले सबसे पहले. So, charcoal will, what will it do, it will adsorb unabsorb the poison and it will prevent from absorption in the systemic circulation. So charcoal acts by its physical action, charcoal acts by its physical action. क्वेश्चन आ चुका है. देन मास ऑफ ड्रग, फॉर एग्जांपल मास ऑफ ड्रग, जैसे सपोज आपको क्या है, कॉन्स्टिपेशन है, आपको सुबह सुबह बाथरूम में जाके बहुत टाइम बैठते हो, आप हो ही नहीं रहा, आपको कॉन्स्टिपेशन हो गया, आपको सब कुछ आपको ही हो रहा है, मुझे नहीं हो रहा है. So suppose you are suffering from constipation, so at that time you are you will be advised with the isabgol husk. Isabgol husk नाम का ये होता है plant product, isabgol husk. So when it will be taken, it will absorb the water from GIT, it will swell. ये क्या होगा, swelling होगा, it will increase the bulk inside the GIT and that will stimulate the peristalsis. So drug may act by its mass, okay, bulkiness, mass, bulk laxative like isabgol husk. Or drug may act via its osmotic property. जैसे होता है osmotic diuretic. So when mannitol is given, it is known as osmotic diuretic. So mannitol का excretion जब होगा, ये water को साथ में लेके जाए. So it is osmotic. Okay. So drug may act via its physical action like adsorption, mass of drug, bulkiness of drug, osmotic property, radioactivity. Certain radioactive elements, for example, iodine 131 is used in the cancer of throat or goiter. Okay. Then barium sulfate is used as a diagnostic agent. Contrast media बहुत सारे होते हैं, phosphorus का होता है, isotope वगैरह. So drug may act by its physical action, in that you have adsorption, mass of drug, in that you have osmotic property, in that you have radioactivity. Okay. So drug may act by physical action, right? First इसमें आएगा आपका absorption, चारकोल का एग्जाम्पल, मास ऑफ ड्रग इसबगोल का एग्जाम्पल, ऑस्मोटिक प्रॉपर्टी आपका मेंटोल का एग्जाम्पल, रेडियो एक्टिविटी बेरियम सल्फेट आयोडीन 131. ओके. देन ड्रग में एक्ट हुआ है इट्स केमिकल एक्शन, जैसे एंटासिड्स होते हैं, एंटासिड सोडियम बाइकार्बोनेट. सो सोडियम बाइकार्बोनेट विल रिएक्ट विद द एसिड इन द स्टमक. आपके स्टमक में एसिड बन गया, एसिडिटी हो गई आपको, आप जाते हो तुरंत एसिडिटी भगाओ 6 सेकंड में, इनो लो, इनो बुलबुले, आप बोलते हो सर इनो दे, इनो बुलबुले, एसिडिटी 6 सेकंड में भगा. कैसे भगाएगा 6 सेकंड में एसिडिटी? इनो कंसिस्ट ऑफ सोडियम बाइकार्बोनेट, उसमें सोडियम बाइकार्बोनेट रहेगा एंड दैट सोडियम बाइकार्बोनेट रिएक्ट विद द एसिड and will neutralize it by chemical reaction, by chemical interaction. So you can say neutralization of acid in the stomach. So the drug will act by chemical reaction. Okay. Then oxidizing agent, for example, KMNO4 का potassium permanganate, ये germicidal है, it will kill the bacteria germs by its oxidizing property. So chemical interaction. Drug may act by its physical action or drug may act by its chemical action. With the example I have to do. So alteration in the metabolic process. A drug may alter a kind of metabolic process. So for example, sulfa drugs or sulfonamides, trimethoprim, methotrexate. What will they do? They so sulfa drugs. What will they do? They will inhibit the folic acid synthesis in the bacteria. So metabolism process alteration. So they will alter the metabolism of bacteria. बैक्टीरिया में फॉलिक एसिड इंपॉर्टेंट होता है उनके ग्रोथ के लिए, सेल के लिए. तो ये सल्फोनामाइड क्या करते हैं, फॉलिक एसिड को बनने ही नहीं देते बैक्टीरिया में. बैक्टीरिया किस में आया है ना, आपको इन्फेक्शन किया है, फॉर एग्जांपल यू आर सफरिंग फ्रॉम कफ, यू आर सफरिंग फ्रॉम रेस्पिरेटरी ट्रैक्ट इन्फेक्शन. सो एंटीबायोटिक्स आर गिवन, okay, say for example sulfonamides. When it is given, it will inhibit the growth of bacteria, it will kill the bacteria by blocking the synthesis of folic acid. So it is an intermediate in the metabolism. So alteration of metabolic process. Drug may act via receptor. Drug may act via receptor. Drug act via receptor like ion channels. तो ion channel के ऊपर बहुत सारे ड्रग होते हैं. For example, दो example है हमें, ठीक है. Diazepam act on a benzodiazepine receptor. So increases the permeability to the chloride ion channel. Barbiturates also act on a, okay, same, that is a ion channel, GABA receptor. Okay, barbiturates, benzodiazepine, glycine, glutamate, all these are the ion channels. Then GPCR, drug may act on a second type of receptor known as G protein coupled receptor. So drugs like propranolol, beta blockers, adenosine blockers, muscarinic agonist, antagonist, they act on a G protein coupled receptor. Or drug may act on a third type of receptor known as a kinase linked receptor. So we have already seen on this insulin receptor. Insulin receptor क्या है? Kinase linked receptor type 3. Fourth type of receptor is intracellular receptor. So hormones, they will act on an intracellular receptor, or it is known as a nuclear receptor. इसको nuclear receptor भी बोलते हैं. So hormones, they will bind to a nuclear receptor or intracellular receptor. They will bring about the change in the DNA. Okay. So drug may act in a different process. Are you getting or not? समझ रहे हैं आपको?